Hey, on today's podcast, we might discuss some topics that are a little bit graphic in nature, so if that's something that you don't want to listen to, listener discretion is advised. Now I'm a little bit embarrassed, a little bit red-faced.
Whoa, Doc, what are you doing?
You are listening to EMS with your hosts, Erik Axene and Matt Ball.
All right, so today we're going to do something, I would say a little bit different, maybe a little bit different, right?
We've kind of done something similar before.
We have. We did a scary stories podcast.
We didn't know what we were each going. No, it was. We did
what
scary
else?
stories.
Yeah, we did. What else did we do?
It was things that you did.
Oh, 5 things that you wouldn't do. Yeah. Yeah, so we've done those in the past.
And it was fun because we didn't know what we wrote.
Correct.
So that's what we did again today.
Exactly. So today is going to be embarrassing stories. Now, we don't have a number like you got to give me 5 or whatever. We're just going to talk about some of our most embarrassing moments in our work field or whatever.
And when we get close to 30 minutes, we'll just be done.
Correct.
Sounds good.
So this will be fun. So if you like our content, make sure to hit the like button, subscribe to our channel. We're available on all the podcast platforms. Also, we have a link to our website in the description. So if you're looking for continuing education credits, click on that link and that'll take you to our website, which is just as entertaining as our podcast.
Now, did you put the warning on this one? Or I guess we're going to do that later.
Yeah. The warning
could be graphic.
The warning will probably go on
one of mine
yeah.
could be offensive to some viewers. So
yes.
If you're watching this and you're...
I mean, we're not going out of our way to be offensive.
No, we want to have fun. And these are medical
topics,
stories.
Yes.
Because of our jobs in the ER and in as a paramedic,
yes.
we have to do certain things that the general population doesn't have to see or do, right?
Correct.
So we were in some interesting situations.
All right, you want to go first?
Yeah, so...
All right, go first.
Being a physician, part of our medical training is to work in clinics.
Okay.
And so I was working in an orthopedic clinic with an orthopedic surgeon.
Okay.
And at the time, I wanted to be an orthopedic surgeon. I'd done all my research in orthopedics. So this was kind of... To me,
this was it.
I really wanted to put my best foot forward.
Sure.
It's like, if I was going to really
I have a feeling.
make sure...
It's bad to say I'm going to put my best foot forward at the orthopedic clinic.
Excuse me. Yeah. You know, it's like a date, right? It's
yeah.
If you really like the girl, you really want to make sure that the car is clean and you dress nice and you don't have a
put on the right deodorant. Yeah, exactly. Yeah.
So I was really, I had my nice pants on, and I had tie and.
This is day one.
Honestly, I can't remember if it was day one, but I do remember though that I was working with the orthopedic surgeon. So this, it's one thing to work with the PA or maybe one of the fellows or one of the other residents.
Right.
But I was with the top dog.
This is with the guy.
A world famous orthopedist, actually. Yeah. He was. Anyway, I'm a really wanted to not look like a fool.
Yeah.
And so I was pretty good and I was ready to go and I felt prepared. But
now, were you actually like doing surgeries or are you going to get?
No, I'm in the clinic.
Oh, so you're just in the clinic.
We're actually dealing with post-op patients, like people who'd had surgeries or people that just come in for, hey, doc. And in this particular case, it was a woman with a sore knee.
Okay.
And so she came in, sore knee, and we were going to do an injection.
Okay.
And before I share my story, I might be giving it away a little bit, but when you're a student physician, this is a long time ago, you wear a short coat. It's like a blazer, a white blazer. I mean,
you look like a waiter.
Yeah. Anyway, so that'll weigh into the story a little bit.
Got it. You got the short coat and the long coat.
Yeah.
So
I'm
now,
wearing a short coat.
See, I didn't know that. And now, so if a short coat guy walks in, get out, baby doctor. Send in the long coat.
You know what's cool about short coats? And actually, I think about this today. And this has nothing to do with the embarrassing story, but I had a physician I worked with that always wore a short coat.
Mm-hmm. I always wear a short coat.
Well, different kind of short coat. No, he always.
I'm thinking that Chris Farley skit. Anyway, go ahead.
Man, a little coat. No, he wore a short coat, and his name's Dr. Sakala. He's an OBGYN doctor, and I loved it. It really made an impact on me, is that even him, and nationally known as one of the leaders in teaching OBGYN stuff, just he wrote a book. I mean, everybody's in medicine would review his content. He's just that guy.
Yeah.
And he wore a short coat because he said, I'm always learning new things.
Keep it humble.
And I
like that.
Humble. He really was. I like that. So, sometimes people said, oh, he's a doctor, right?
Yeah,
but
yeah.
you know what? I'm always learning new stuff. We learn stuff together all the time.
Yeah.
So I like that
teach me a lot
short
of
coat
stuff all the
mentality.
time.
So when you're a student physician, you wear a short coat,
Got
which
it.
signifies to everybody you're not a real doctor.
Yeah.
You've
You're
had
a baby doctor.
You're in school still. You're not a doctor yet. When you become an MD, you get the long coat.
Yeah.
And it's a bit of a kind of a, it's bragging rights
Sure.
in some ways. But
Absolutely.
I love what Dr. Sakala said, and I love that. Always learning. He didn't care about the whole long coat thing. He always wore a short coat to let everybody know.
Yeah.
That he was always learning, and he was the top dog.
Yeah.
Anyway, so back to the clinic. So I'm in the clinic with my short coat, and the doctor said, "Okay, Eric, why don't you?" Well, I mean, we kept the consent, and this is student Dr. Axene, and he's going to inject your knee, ma'am, with the, to help her with her knee pain. So I stick a needle, into the knee and inject the medicine, and that was my job in the clinic. So the orthopedist is sitting on his stool, I'm sitting on mine, and anyway, with the way she was oriented, I actually got up out of my chair and went to squat down next to her to inject the knee. And as I squat down, I ripped my pants from, the whole inseam, like completely wide open, and it wasn't just a little tear. Anyway, so these pants, I was wanting to wear nice pants.
Yeah.
To, in this
Impress,
rotation.
yeah.
And I guess I put on a little bit of weight, and they were a little tighter than maybe they should have. And I ripped them. And wearing a short coat, I couldn't hide it. And, where are you going to go?
Was it loud enough that they heard it?
Oh, everybody heard it. She heard it. The doc heard it. He laughed at me. He thought it was so funny,
Like laughed in a good way or like, way to go, idiot?
No, he laughed in a good way.
Okay.
It's kind of like your guys would rail you.
Oh, 100%.
Oh, he totally did that.
Yeah.
And I had to walk around for a good bit of time.
What did the patient say?
She just, I honestly don't remember. I was so mortified. I don't remember her reaction, but I do remember the orthopedist and the staff in the clinic just,
laughing at
me. And I took it well, but I was so embarrassed because I'm trying to be the guy. I wanted to be that great resident or student. One of the medical assistants said, I'm going to go down to the med center because we're attached to the med center. I'm going to get him a pair of scrubs. And so while I waited for the scrubs, which seemed like a lifetime, I'm just airing out my underwear.
You had skivvies on,
wide open. I can't hide it. I got a short coat.
You got skivvies on, I hope.
Oh, yeah. I got
Okay,
skivvies.
Good. So then you had to wear a button-up shirt with a tie and scrub pants the rest of the day.
Basically no pants. I was basically wearing chaps. That was embarrassing to me. Not a huge deal, but man, I remember being mortified.
That's funny.
Ripping my pants.
That kind of reminds me of one of my stories a little bit. I didn't have them in order, but this is actually a nurse story. After I had become a nurse, and what was actually interesting is after I had become a nurse, I was a paramedic for a long time, and then went to nursing school. And I actually had a difficult time trying to find a PRN job as a nurse, because most hospitals are like, well, yeah, but you're a brand new nurse. I'm like, yeah, but I've been a paramedic for 15 years or whatever it was, Anyway, long story short, I got a job in an ambulatory surgery center, and it was day one, and I worked with some great nurses, and I go in, pre-op area, they're kind of it's literally my first day, and they're going in, showing me the pre-op area, we're looking at PACU, and they got the pre-op patients in, so I'm working with one of the nurses, she's kind of telling me the whole rotation of everything, and it was, I don't know if it was the first patient, it was the first patient I was dealing with. She was getting vital. She's like, hey, why don't you go ahead and get an IV? Well, Mr. Paramedic, I'm like, no problem. I got this, right?
I can get an IV in a rock.
It's not what you think it's going to be. So I go in. I'm getting all the stuff set up. And I'll just say that one of the head doctors, kind of like you're talking about, that was like one of the guys over this center, comes walking in, and they kind of introduce me to him. And I'm doing my IV, like, hey, whatever, doing my thing. Get the IV, no problem, clean up my stuff and walk away. He comes over to start assessing the patient, and I had left the tourniquet on the patient. I had completely left it. And he's like, well, one thing is you might want to take the tourniquet off after you're done. And I looked down and I was like, if I looked at this other nurse that I was working with, and we both kind of laughed, It was just one of those things. But I felt like a complete and total idiot. Like, right in front of the boss, the head
At
guy.
least you didn't bury yourself. Really.
I didn't. Yeah, it wasn't that. It was just embarrassing because you think I've been doing IVs for 15 years. I got this. Yeah. You thought it was muscle memory, but different setting.
Yeah, sometimes it's good just to,
wear the short coat and be humble.
Yeah, right. Always good to do.
Always a good idea to be humble, because the world will this business will have a way of humbling you.
Oh yeah,
real quick.
Yeah, and you know what? I had a story. I was in the ER. I never fart in public, right?
Always a good practice.
Because you want to be polite.
Especially as a doctor, don't go
least,
ripping them in the patient rooms.
At least portray some sophistication, maybe. So I'd go outside to the ambulance bay outside and fart, outside. True stories from a doctor. Anyway.
So if you see a doctor standing in the ambulance bay.
He's not smoking.
Exactly. That's fine.
So anyway, that was kind of my thing. And
okay.
So anyway, I'd go out and if I had to, let it out, I'd do that. And
so for the record, doctors fart too.
Oh yeah.
It's not just firemen.
Come on. Anyway, so as I'm walking towards the ambulance bay doors, to let loose, I don't know what I had to eat, but I had a lot of gas, and it was starting to hurt because I've been holding it in, right?
Yeah. It's like that first date gas.
Yes, exactly.
As soon as she gets out of the car, I got to let this rip.
I'm allergic to something because I do have a lot of gas, to be honest. Anyway, so I'm walking towards the ambulance bay doors to go outside. And I see the Family Guy on in the EMS lounge. And so I walk in there kind of to the side, and I'm like, it's 2 a.m. or whatever. I'll be fine here. And so I'm watching.
Dark. Nobody's paying attention.
Orange Cry, watching the Family Guy, and I just let it go. It's like so loud, foghorn. I mean, they probably could have heard it in the ER, and it smelled. And then I hear, "Hey, what's up, Doc?" And I turn around, and there are 3 firefighters sitting in the lounges watching the Family Guy as I'm standing between them and the TV in the dark. I didn't know they were there. And I just walked away. It's like, oh my gosh.
You didn't say
sorry.
anything?
Oh, sorry And I'm leaving. And,
Do you remember who it was?
I don't remember who it was. I don't even remember I don't want to know.
Yeah, right.
They're probably telling the story right now. That was us.
Oh. Well, the good news is I've never heard that story, so if it was one of our guys or our guys...
It could have been yours, but it may have been another department. A lot of folks come through our ER, but that was super embarrassing. It's kind of funny.
Yeah. Fart stories are usually good.
Yeah.
I was pretty new. I was riding on a truck one night, wasn't on the ambulance, and we had gone on a wreck on a pretty busy highway in the city. Mm-hmm. And we were getting out. Cops were already on scene. They had called us out to kind of block the road, whatever like that. So I wasn't thinking as our driver. Like I said, I was fairly new. I mean, it's first 6 months, right? Yeah. And so the driver parks. Well, he parks, and I'm nervous, every call that we go on. I'm super nervous not to look like an idiot.
When you're new, yeah.
And anyway, long story short, I get my gear on. I'm ready to go. We actually had a different captain than was my normal captain was there that day. And we're going to walk up and see what we need to do on this call. As I get out of the truck, I'm on the officer side, so the passenger side of the truck. Well, I don't think about the driver is actually parked kind of off on the side of the road. Well, as I get out, I'm not paying attention, and I roll off into the ditch, into the road ditch.
Like tumble down the hill.
Just completely, completely go.
You know that scene in Princess Bride when they're
rolling down
as
the hill? You wish. Yeah, that's what I'm doing. I'm just,
all your gear.
Oh, God.
All your glory.
Luckily, I didn't have an SCBA on it, but I had all my gear on, my helmet. My helmet goes flying. I'm not expecting this at all. So it's dark out. It was nighttime. So I get out, take like 2 steps. And
How far did you fall, really?
Oh, I fell probably 10 feet down this little ditch, and they all.
You didn't get hurt, did you?
No, I didn't get hurt at all.
That would
and immediately jumped up. I'm good. Well, I jump up, and everybody's looking at me.
I could have broken my leg. I would have jumped up and said, "I'm good."
Luckily, I'm very agile, and being a former gymnast, I can bend and roll pretty easy. But as soon as I pop up, like hoping nobody saw. Oh no, everybody saw. Everybody saw. Even the guy who the PD had him out was going through the DUI stuff. And he sees, and the cops are all looking, the captain's looking, the driver's looking, they're all looking at me.
Awesome.
And the guy that's about to get arrested, or, he's like, I'm not intoxicated. That guy, you ought to go check on that guy. And they're all looking at me like, way to go, idiot.
Pulling the grass out of your teeth.
Oh, God. It was so embarrassing. I felt like such an idiot, but
that's funny.
What are you going to do?
That's
things happen.
well, that's it. It's like, what are you going to do with all these stories?
Just
I
take
think.
it.
I was working in the ER, and in this particular hospital, which happened to be Hotel California. If you've ever listened to the Eagles song Hotel California, that's actually, it was a drug rehab hospital, and that actual physical hospital is where I trained. Part of my training was in that actual hospital.
Really?
That the Eagles, Don Henley, was singing about.
Yeah.
Anyway, pretty cool experience. I really cut my teeth there. I mean, it was pretty awesome. But anyway, I was there, and the way they had it set up, and you could be listening to this, maybe even have worked there, but there's a big glass in area where the doctors stand and work at their station.
Okay.
And then all the trauma bays and the sickest patients are kind of around there, so you can kind of keep an eye on some of your sickest patients.
Sure.
Well, this lady had come in, and her defibrillator was firing.
Okay.
Yeah, and she was really obnoxious. When it would fire, she would kind of go crazy and make a big scene.
Sure.
And so when she came through the ambulance,
justifiably so.
Yeah,
Probably hurts.
But from a doctor perspective, we're like, well, it's working.
Yeah.
Because otherwise you die.
Yeah, exactly.
I'd be doing chest compressions.
Yeah.
Anyway, so she's really kind of
being
obnoxious and dramatic. Yeah. And so we put her in one of those bays where, it's like where everybody can see her and keep an eye on her.
Sure.
And so I was next up as my patient. I went over to examine her. And a couple things about her. She had very large boobs. I mean, just huge. Okay. And and she was wearing an outfit that really accentuated them. Anyway, so I'm going to examine her, and part of our exam with a cardiac, you got to listen to the heart. So as soon as I put my stethoscope on her chest to listen to her heart, it fires, and she grabs my head and pulls my head into her breasts, going obnoxious and crazy, yelling, and she will not let go. I mean, she had me in the death grip. I mean, she must have done jujitsu or something, right? So my doctor colleagues tell the story where they don't see my head, it's buried, and they see my arms and my legs flailing about with her going crazy dramatic.
Right in front of everybody at the doctor's lounge.
And
that's funny.
Of all the patients it could have been, because everybody obviously noticed the obvious things, and she pulled me right into it. And it was so embarrassing. They heckled me for quite a while about that. That was funny. So.
That would be a good one.
Example of a medical story that may be offensive to some viewers.
Correct.
I don't know. I mean, it was just
these are the real life things that happen on calls and in the ER. I actually had a lady similar. Not she didn't pull me into her breast, but we had gone on a lady who was complaining of shortness of breath and chest pain, and we get her in the back, and we're kind of going through the motions, doing our assessment and all that stuff. And she was fairly young, wasn't an older. She was a relatively attractive lady. And anyway, doing my assessment. And so we kind of get to the point where I'm like, I need to do a 12 lead on her, right? Yeah. And so, I always try to be mindful, of a woman's privacy. I have two daughters.
Professional, with somebody there.
Absolutely. I'm like I said, I have two daughters. I want to be mindful of that, be respectful of that. Yeah. So I always, hey, because you're having chest pain, this is what I need to do. I need to put these stickers on you. Some of them need to go under your left breast, so I need to kind of expose you a little bit. And she's like, yeah, okay, fine. And she basically just starts opening up her shirt and sitting forward no modesty whatsoever. And I'm like, okay. It was just a totally different reaction. Not really embarrassing, but I was more just
She was probably a nurse or something.
Well, I don't think she was a nurse. Anyway.
Not that nurses do that.
I think she may have worked in an industry where she may have gone around with her top off before.
Okay, I see.
Yeah.
Okay.
But the funniest, so she goes and she had a bra on. And I was like, well, I need to undo your bra because I have to put these leads under, right under contact, the skin under your left breast. And so she just sits forward wanting me to unbuckle her breast. Usually I'm like,
unbuckle her breast?
I'm sorry.
That
would have been embarrassing.
A very interesting story.
Unbuckle her bra, the back of her bra.
Yeah.
Well, she sits forward wanting me to do it.
Yeah.
And so again, trying to be professional, do you want to do this? Do you want me to do it? And she kind of looks at me and she's like, honey, I'm sure this isn't the first time you've ever done this or the first pair you've ever seen before. Like, she just blurts this out, and now I'm a little bit embarrassed, a little bit red-faced, because she is way more comfortable with her being topless than I am with her being topless. It was a very awkward situation.
Well, there are varying degrees of comfort with patients.
Oh,
Some patients very, very discreet, you know, and I actually tend to be that way. I don't.
Yeah.
The next story I was going to share was naked in the ocean. I don't know if I ever told you this story.
Oh, you were naked in the ocean.
Yeah.
Wait, well, you did tell us a story on your scary stories.
It's related to that. But the part of it that was embarrassing, though, is that I had to walk as a 13-year-old who's kind of went through puberty late and I hadn't gone through it yet.
Yeah.
Most 13-year-olds maybe have gone through puberty.
Yeah.
I hadn't.
Yeah.
And I had to walk out of the ocean because I was stuck in the undertow, and the undertow pulled my pants off.
Yeah, right. And
I had to walk out of the ocean.
Yeah.
I had to walk out of the ocean naked. And
so how far did you have to walk?
And
your
beach.
aunt didn't bring you a towel when she saved you?
No, I got a towel. Well, she was in the water with me.
Yeah.
So we did get a towel. And
she probably didn't realize you were naked. Yeah.
So embarrassing.
So how far did you have to walk?
Mortified as a kid. Well, the problem is that these waves were so big that they'd actually gone up into the parking lot. Everybody had to pull their towels and beach equipment and all that stuff and walk away, so that everybody was pretty far away because these waves are so big. So I had to walk quite a distance.
But they were all still watching.
Yeah, but I was mortified. As it's actually a traumatic story.
Oh, that would be traumatic
afraid
for a
of
13-year-old
waves.
kid.
Just the wave story was enough. But then my modesty.
I almost died. I almost drowned. And then the most embarrassing. Then I had to walk naked in front of 100 people.
And you know what? To a 13-year-old prepubescent kid in front of a bunch of
died
beautiful
in the water.
Women, yeah, it's like that was almost worse than
100%. I could see that. Yeah, that would be terrible.
Yeah.
We did. This wasn't overly embarrassing. Kind of fun, a little bit embarrassing. They pick on me about it. I'll say this. There's a couple of guys. One guy in particular who we both know, who he had come to my station. This is years ago. He had transferred from that station to another station, him and another guy. And they were asking me, we had a jail facility, was in the district of this one station that I worked at. And I had worked at this station for a couple of years. And so they had come over, and we were just talking about, different stuff. And he asked me, hey, how often do you guys go to the jail? Well, I told him, like, the reality, not very often, a couple times a month, it's not tremendously. Now it's crazy. It's same jail, same district. But at that time, it was 4 or 5 times a month. We would, on average, we would go to the jail.
Right.
That day, we were on that med unit. We went to the jail 3 times.
In one day.
In one shift.
Wow.
And all 3 calls were all femur fractures. I have no idea what, and so to this day, this is almost 20 years later. If I see that guy, he will still, I remember the time Ball told me, we only go to the jail once every month. And we went there 3 times.
3 times in the shift.
3 times that day we went to the jail. I had not gone to the jail 3 times in a shift ever in my 2 years working at that station.
Isn't it funny how that happens sometimes? You'll hear about something for the first time. You've never heard of it before. Then you see it all the time.
Red cars.
Yeah.
Yeah, or you start looking at something, and exactly. It was the weirdest thing, and like I say, wasn't overly embarrassing. It's embarrassing now because he loves to pick on me about this story because, we love firemen.
I had a story, again, not overly embarrassing, but it was, clinically speaking for a physician, it was really embarrassing. I was taking a ring off of a patient with my, I've got these trauma shears, they're called a Raptor, and they've got a ring cutter mechanism in the handle. It can cut through rings like butter. And I like to use it. It's easier than the ring cutter, so if I can, I'll use it. And this was a perfect candidate for it. It's a smaller, thin gold ring that was causing issues. Snap it real quick. Anyway, I wasn't paying attention to the other end of the shears. So if you can imagine, I know if you're listening to the podcast, I'll try to describe it, but if you can see, the trauma shears are out here, and the ring cutters would be back behind the shears. Right. So as I'm focused on the ring cutter portion of my tool,
you're not paying attention.
I'm not paying attention to the shears, the sharp, razor sharp shears that can cut through metal.
And are very heavy duty shears.
Oh my gosh. Anyway, I caught her palm in that and created this giant V-shaped laceration on her hand trying to fix the ring. So it was really embarrassing to me to cause a nasty injury, bled like a stuck pig.
Oh, sure.
Oh, I was so mortified. So I had to fix the laceration I caused by taking her ring off. I got the ring off fine. She was happy about that, but not so happy. And her husband was watching.
Oh, no.
Anyway, I called the hospital and whatever, made sure she wasn't billed for that.
Yeah.
You know, but that was pretty embarrassing.
That would be, yeah. Yeah, it's never good when you're doing things. Like I say, we've missed IVs or things like that. You know, we have those embarrassing stories when you go and you miss an IV or something like that. Those are never good when you're not intentionally, but some harm happens to the patient.
Yeah.
I was trying to think. Let's see.
I have one. Oh,
Go ahead. No, you go ahead.
You reminded me of another one. I've got many. This was terrible. So, you know, when you're busy in the ER, there's a lot of patients that need to be seen, and you're looking at chief complaints. And sometimes what I'll do is I'll see a number for the room, and I'll also see an age, and sometimes I'll mix them up.
Oh, sure.
Like I'm going to room 26 to see a 22-year-old, so I'll go to room 22. It's just
See
kind
a
of
26-year-old?
Exactly. So the planets aligned in this particular case. The chief complaint was a little bit embarrassing, though. This guy was having an issue with his penis, and I needed to examine it. And I walked into the room. He's you know, wearing jeans and, you know, his clothes or whatever. He hadn't been put into a gown yet. Yeah. And so I walked in and had this conversation where, in my mind, I'm talking about his penis problem. But I don't say, hey, I'm sorry about your penis, because there's another woman, his wife likely is in the room with him. Yeah. So I'm saying, man, I'm so sorry about the pain, and I'm excited to be able to help you today. And probably didn't say excited. But,
yeah, that would be a bad word.
Yeah. But I said, you know, it's kind of like your normal spiel you'll go through just to make a patient feel comfortable. So I'm talking about how I'm sorry about your pain. I didn't, you know, and I'm, you know, I'm going to help you out. And anyway, so I'm to examine you. I need you to be, you know, take your pants off and get into that gown. And if the nurse hasn't told you to do that already, and I'll come back and examine you. And so they did what he needed, you know, took off his pants, but he was there for a knee complaint. Oh. And I'm there to examine his penis, right? So, and with the way our conversation was going, it fit. Where he's thinking knee, I'm saying penis.
Take your pants off, got to look at your knee.
It all
makes sense, yeah.
Well, it was about to get embarrassing. So I come back in the room and I see he's all ready to go, and so I lean him back, you know, and patients are good, they're compliant, right? Yeah. And oh, this makes me sick. So I lean him back, and you know, and you know, if you're going to do a knee exam, that's a reasonable thing to lean him back. Sure. What isn't reasonable is to pull the gown up to start pulling his underwear down to look at it, and whoa, Doc, what are you doing? And I found, anyway, that's when we figured out he's there. I'm in the wrong room. And he did not tell me, you know, all these things had been happening, and the workup had already been started. He'd seen another doctor. He thought I was, you know, you never knew. So many people.
He thought you were some whack job weirdo.
So I had to explain to my colleague how I just pulled the pants down to examine the penis of your patient that's here for a knee problem. I was embarrassed. We had a good laugh in the room.
Yeah. He was a good sport about it.
You know me. I'm lighthearted. We kind of laughed about it. I explained how I'd mixed up the room number and the age. And
so sorry about that. So but your penis looks great.
That was
well, that's probably a good one to finish on.
Yeah.
That would be.
We could do this again. I've got a whole portfolio of foolish things I've done.
For sure. We could do it again.
And it's good, you know, it's good to laugh at yourself.
Absolutely. Yeah, it's always good to have a short coat.
Yeah. It's good to have a short coat.
See you on the next one.
Be safe out there.
Thank you for listening to EMS, the Erik and Matt Show.